on speaker view. All right. Okay, so good morning, everybody. Thank you so much for being here. We are super excited to have Dr. Jamal Rahimi speaking to us today. He's an MD HS alum. As Dr. Pintado said earlier, once a Red Devil, always a Red Devil. So without further ado, I'm going to go ahead and pass it on over to you, Jamal. Thank you so much for being here today.
All right. Well, thanks for having me, Aaron. Good morning, everybody. Mount Diablo. Wow. I mean, the rooms look much nicer. That's great. Yeah, I can see that. So my name is Jamal Rahimi. Please, I like going by my first name. And I am, as Aaron was saying, as Ms. Harper was saying, I am a graduate of Mount Diablo High School. And I'm what are you guys, like 17, 18 now, 16, so much? I'm over double your age. Oh my gosh. Oh wow, none of you were born when I graduated, so that makes me feel really old. All right,
don't give
just
away
so
our
everybody
secrets.
knows. And yeah, Mount Diablo was quite an experience, going there for 4 years. It's really interesting to have a city like Concord where we have like 5 high schools, right? Like there's so many different high schools to choose from depending on where you live and where you go. And I always say I was lucky enough to go to Mount Diablo. I think Mount Diablo at the time, and hopefully still, really is one of those schools that opens your eyes to the real world, really, more than anything else. It opens your eyes to learning how to traverse what the world really is, learning how to talk to people, learning how to talk to the teachers. And I think the teachers are some of the best out of all the schools, because my brothers and sisters went to other schools later on. I was the eldest of 6, so everybody else ended up going to different schools, but I did go to Mount Diablo. So, and my sister actually, who graduated 01, Aaron, with you, I believe 01 or 02, somewhere around there. She's gonna kill me, but
yeah, I think with my sister in 02.
Yeah. So I want to, first and foremost, it's interesting to see everybody in masks, and interesting in a good way. And I appreciate you guys doing that. Coming from Houston, Texas, right now, the laws are a lot more laxed, and we're seeing a lot more sick kids, especially, in your guys' age group, and, teens, early 20s, early 30s, those are still young when it comes to COVID. So it's something that I'll tell you, like, keep up with it. It's important. We're almost there. We're almost out of this. I know this sounds like, oh, it's so far away, but by summer 2022, I think we'll have a good handle on all this, and we're going to be moving forward. So we're only going to get there and move forward with people like you who are doing the right thing and wearing masks inside, outdoors, wherever you can, and avoiding getting other people sick. Because as we know, when you're not the selfish type, you're wearing a mask not only for yourself but to protect your friend's grandmother, your friend's father who's got diabetes or some other condition that can get them sick, or your friend who has some condition and can get them sick. So even if you're going to do fine, you're doing this for other people, and that's not selfish. And so it's one, again, from somebody who's fighting the war on the front lines and seeing very sick people every day. I appreciate seeing this, and it really makes me feel better, and I'm very happy to talk to you guys. So I want to begin by just showing you a quick, if I can share my screen, just something quick. I found this earlier, and we'll go over just a little bit about me, and then we'll talk about what the pathways to becoming a doctor, and the options, as well as career opportunities, and my pathway, and what we really see. And really, a lot of this, I want it to be as interactive as possible, and this is usually what I like to do in these talks. So I'm sure people have questions, and save up your questions, or ask them as we go. It just depends on how it works. But please, I'm here to answer all of them, and I will tell you, I'm one of those people that will answer very honestly. I mean, that's my job. My job is to be honest with people, and that's what I do. So I will answer your questions honestly, even if it's not something you want to hear or someone else wants to hear. But I think that's what we all need. And so let's let's go ahead and I want to show you a little bit here. Where are we? And I'm not good with Zoom. I don't do this very often, so bear with me. Are you able to see? Believe it or not, look at that. 22 years ago. Almost to the October, almost to the day, right? We're about a month away. So while everybody else gets a good laugh into, yes, that's me. And I was a junior in high school. So a couple of my friends here are seniors, I can tell. And this was our prom, I believe. And so you can go from being this goofy little kid to something better in your life later on, I promise. Okay, so I show you this because of that. And you know, time flies. Wow. So a little bit about me. So I did my undergrad at UCLA and graduated in 2006. I went to UC Davis for medical school. I was lucky enough to be able to stay in California. It's a pretty hard thing to do. Medical schools, as people know, are quite competitive. So you're very happy to get into wherever you can, really, a lot of times. And I was just very happy to be able to come, you know, mostly back home, not in the Bay technically, but close enough. And so I did my medical school in UC Davis, and then decided to finally break the golden chains of California and leave and travel somewhere else and do my residency. So I went to New York City, Long Island area, and I did my training there in emergency medicine. And then I decided, I met my current, I shouldn't say it that way. I met who would soon become my wife during residency. And so we decided, she did not want to, she's from New York, so she didn't want to move to California, and I didn't want to stay in New York. So we split the difference and came here to Houston, kind of third coast kind of thing. And we've been in Houston for about 7 years now. And we like it, other than the weather. The weather sucks. But the people are nice, believe it or not. You know, we hear a lot of things about Texas, but the people are nice in a way. And I know the laws are crazy, and it's just weird, you know, it's because I'm a California kid as well. I'm a Bay Area. I say I'm a Bay boy, you know, I'm a California kid, and come seeing laws, and we're not going to get into the politics, but it is a little disturbing, even from being a physician, to see what, you know, the trend is here. So it does make me wonder if I'm going to stay here much longer. We're definitely, my wife and I have decided we're not going to have our kids go through the schooling system here, so we'll likely end up back, fingers crossed, in California, you know, or somewhere where they teach school correctly. So this is, you look at this, right? And the reason I show this is because you see this and you're like, oh my gosh, this is a resume, right? How am I ever going to get to this? If I need to do this, how am I going to become a doctor? Well, there's always two sides to every story. And so if we change it, this is also my story. So after high school, I wasn't ready. I didn't take my SATs. I signed up for the PSAT, and then the morning of, my dad dropped me off and I skipped it. And I didn't take my SATs. And so I took a year off out of high school and went back to Afghanistan, where I'm from, was born, and spent some time there, and in Pakistan, and visited some family, and was forced to come back by my family. My parents were like, look, you got to start school, you got to go back. And I wasn't ready. I was a high school student, just graduated, was enjoying my time, and I wasn't ready. So I ended up taking a year off out of high school. So if you take a year off out of high school, you're not getting in and not taking your SATs, you know, you've already set yourself kind of back. And that's what I did, not realizing it. I was the first person in my family to go to college. So it's something that I didn't have anybody else kind of guiding me into that area, you know, down the correct path. So it was something that I had to struggle and stumble upon myself. But thankfully I was able to. And so when I came back, what did I do? I did what all my friends did. We went to junior college, we went to DVC. So I went to DVC, and did I spend 2 years at DVC? No, I spent 3 years at DVC. I spent 3 years at DVC, and in the first year, I started off as a drama major, and then after the first semester, I dropped that to a English major. I really like writing papers, and that was one of my strong suits. And even in high school, I was in a lot of advanced English, a couple of advanced English classes, and so that's what I liked. I wanted to grade papers, write stories, those kind of things. And then as I progressed in junior college, I did take science courses because I always found science easy in the sense of I just had to memorize things. And so it was easy to get an A on an exam because it was, this is what, and you memorize it and you write it down. I mean, that seemed easy to me. What wasn't easy was writing a 25-page paper on a topic. Like, that was intriguing. That was, that was what I liked. So the other stuff was just easy to beef up your GPA. And as I moved forward in these more advanced bio classes, I realized, oh, wow, I'm good at this. So like, it's not just memorizing. I like it and I'm good at it. And I watch a lot of my friends kind of drop off and went from, medical pre-meds to business majors and other things. But I just kept going. And I was lucky enough. I worked hard. There's a lot of luck, but there's a lot of hard work. And I was able to transfer after 3 years to a college, and that was UCLA. And I did well at UCLA, and I applied. But guess what? I took a year out after college as well. So a year out after high school. So a total of 5 years to graduate college, 3 in DVC, 2 at UCLA, and then another year off. So I'm starting medical school at the age of 25. I'm not starting medical school at the age of 22, 23. The age that everybody thinks you should start medical school. I want to let you guys know that's not the average age anymore. It's not common that people go directly from high school to college to medical school. That's a less common route nowadays. People are taking time off because it's important. It's important to get your mind right. It's important to explore other things. It's important to, chase a dream of yours for 6 months or a year that you want to do before you commit so much time to the art and practice of medicine. So it's one of those things that is quite common to take a year off here or there and start medical school at the age of 24 or 25. At UC Davis, when I started, the average age was 25 years old. The oldest person in my class was 49 years old. He was a medical student, year 1, at the age of 49. He had raised his kids. His kids are now off into college. He was an engineer, and he looked at his wife and said, my life dream was to become a doctor. And so he did. And guess what? At the age of 53, he was an MD. And guess what? It's 10 years later, he's still a doctor. So it literally is never too late to pursue this dream and goal, if it is a dream and goal of yours, to become a physician, because you can literally stop whatever you're doing, say, if you have the commitment and the drive, like, I want to pursue this. And it is possible. All we're taught is grades, grades, grades. You'll never get in. You'll never get in. You'll never get in if you don't go to a good school. You'll never, and that is all, I think, the biggest BS and some of the biggest lies that are fed to a lot of students that really, make them less inclined, less wanting to pursue something like medicine. As we know, getting an MD is the hardest, they say, the hardest profession to get into, or the hardest degree to get in this country, if not the world. I mean, I think becoming an astronaut's way harder than becoming a doctor, and that's what I wanted to do from the beginning. But here I am. But NASA is down the road. So Houston, we have a problem. It's from NASA. NASA is about 50 miles down the road, so we do get to go down there and see them quite often and pretend to be astronauts. So now I'm here. So if we compare this, they're both me. And it's how you want to see yourself. It's how you want to present yourself and what you really think your worth is. Because on the left of your screen, that's me. But more than that, realistically, on the right of your screen, that's who I really am. That's how I got to the left of the screen. So your story might end up being very similar. You might not do so well on your SAT and then that's the end of your world. It is not the end of your world. You might go to a state school and say, well, I went to a state school and they told me because I went to a state school, I can't get into medical school. Garbage. 25% of my classmates at UC Davis were from state schools. You know, the numbers around there. I was told when I was in UCLA and I went to go see my counselor because the way I was dressed or that's the only thing I could think of. She told me not to pursue medical school because it wasn't for me. When I told her this is, I finally decided, yeah, I'm going to go to medical school. I'm doing well. Like, this is not imposter syndrome. Like, I got this. And I remember her telling me, medical school is not for you. And I couldn't understand why she said that because apparently she didn't look into my transcript because I was magna cum laude. I had a 3.77, 3.78 GPA at UCLA. So it wasn't that she bothered to look into my transcript and saw that I was acing every single class I was taking. So it had to be just the way I looked, my presentation. Maybe I was a little too chill or relaxed when I sat down next. I don't know. But I saw her a second time and she told me that the second time, a few months later. So there was something about me maybe that didn't click to her that I could become a doctor, be a doctor, look like a doctor, act like, I don't know. And now that, I am a physician, I look back on that and I say, well, why does a doctor have to look a certain way? Why does a doctor have to act a certain way? And I don't mean act a certain way, like we're not acting like fools, but if I have an accent, if I talk a little differently, if I'm a little bit more nonchalant, and I'm not so prestigious or acting like it, because I'm not like that, I'm not acting like a doctor. I don't know, but there is this culture of medicine where people see physicians and see them as this infallible, like, oh my gosh, they're this, they're doctors, they know everything, they're not gonna lie. That's also garbage. Doctors are people, and people are people. They make mistakes, they lie, they can cheat, they can steal. Obviously, we don't want any of that. We don't want those people to be our doctors, but again, doctors are people. So I've always been against that stereotype of what a physician really is, because there shouldn't be a stereotype of what a physician is. A physician should be whoever wants to be a physician and help their fellow man. That's who a physician should be. How they look should not matter. Unfortunately, their grades should not matter, but that is your entrance, right? So we will talk about that, the entrance into this stuff, but those things shouldn't matter. So when we present ourselves and we show to the left, this is me, I went to UCLA, I did this, I did that. There's a lot of struggles behind that. And those are my struggles on the right. It took longer. I took more classes. I took some time off. I wasn't sure of myself. I was told not to go to medical school. So those are all things that really I had to get over and know that, I want to be a doctor. Like, I know my counselor knows more than me and saying that I can't be a doctor, I shouldn't be a doctor, but I'm going to give it a shot. I have no doctors in my family. I was the only one to go to college at the time. Thankfully, all my siblings they're all getting there, and several of them have been. So it's one of those things that, you kind of make your own mold and you go from there. And if you believe it, you can achieve it. And that's really what I say, because it doesn't take anything more than just hard work. Hard work. So what does that mean? When I was a lot of your guys' age, my mom and I tell everybody this story, and I don't even know if she's going to remember this story when I see her next and tell her I told it again. I was a troublemaker in high school and all that other stuff, nothing too crazy. But she would tell me, she said, Jamal, focus on your school, go to school. The whole, as a lot of us know, the immigrant family mentality, right? Like, we're here in this country because this country has everything to offer us. And that is quite true. When you know where you're coming from, you come here, you know that there's a lot of things that this country can offer you that your own home country cannot offer you. You're going to work hard to get those things, because even if you worked hard in your own country, you wouldn't get those things. So that. So my mom used to tell me that, hey, in 10 years from now, you're going to be 10 years older, right? You're going to be 27 years old in 10 years. That's not going to change. So if you work at McDonald's and you work at McDonald's now, and then in 10 years, you're still working at McDonald's, you're still 27 and you're still working at McDonald's. But if you from now put in work and go to school and get your education, in 10 years from now, yes, you're going to be 27. That's not going to change. Time is going to get you. It's what you do at that time. So in 10 years, if you work hard and study hard, you can become something. And that was the biggest truth, because I look back and yes, the only thing was time changed. It was the time. It's what do you do with that time? Because that's the only thing you can change. You can't slow down time. You can't speed it up. It's going to catch up to you. So in 10 years from now, you're going to be 10 years older. It's what you did between now and that 10 years is where you make the difference in your life.
Hey, Doc,
So
I guess I love the instructions at the beginning of your presentation about asking questions when we have a question, or we wait till the end, or I love that.
I think I like it more interactive. So if anybody has any question now, that's I'm more than happy to answer it now and talk about it. I think that's great, because a lot of these questions open up to a lot of discussions as well.
Because I think we gave the students the option. These days have been really, really difficult, Doctor. In our school, talking about Mount Diablo High School, we had a lockdown a couple of days ago. We got some issues going on. Currently, we are under, heavy stress. We have right now less than half of the class present, and I need you to know that, because for me, again, having you talking and telling them about what you went through, and especially the cultural part. Where are you family from, Doc?
So I was born in a refugee camp in Peshawar, Pakistan.
My gosh, look at
During the Soviet-Afghan War in the 1980s, my mom had walked, I think it was a week and a half, 2 weeks. She was about 15 years old, 16 years old, through the mountains to get out of the country, and via basically horse, donkeys, those things. And her and her family were able to make it to Pakistan. My grandfather was her father, as well as my father, who was not yet my father, were all locked up in the Russian prisons in Afghanistan during that time. My father was able to escape. His younger brother was executed in that prison. I think he was about 14 years old at the time. My father took up arms and fought the Russians, and then was shot and injured himself, and was nursed back to health by an Afghan family for several months. But his family thought he was dead, because the word got back that he was dead. So when he arrived in Pakistan for safety, his mother was like, you know what, we've lost too many family members. We're going to marry you off. It's too much. So they ended up, my mom and dad got married. I was born in that camp in a kitchen. My mom lived in the kitchen.
You are like in a movie. It sounds like a movie, not obviously a movie, that is fun. Ritual, movies that we've seen, all these families that migrate from countries under war, and it's obviously you are. I believe in a supreme being. You definitely were touched your family by the supreme being, because to be where you are right now, Doc, honestly, and to go through all that you went, is I mean, a life story that, again, I have a friend, but not a friend, is a colleague from my hometown that he had something not similar, obviously now under war time, which is the wars. I mean, I can just imagine you and your family now where you are now. And, I have students from Afghanistan, and I greet them in the morning. So, hi, Shotor Asti, who, I love that because I know that they're here and they've been through a lot. And, but you said something about being a doctor, and it's, we're humans. We're like everybody else. And, obviously you are in the ER department, which is between you and me and the rest. When I rotate my family practice residents, that ER, it was tough. It was really, really tough. And I love, all those things, but imagine what you see every single day. Your skin should be like probably this thick, like with all you have to see and treat. And now with COVID, all what you've seen. And again, I'm really, really happy that you came today and opened your time, which is precious time, and time for your family, for your own, that to share with these Red Devils here. In our case, we have also Ignacio Valley present here. Nicole Zimmerman is the teacher that is there, and I know that the students are also being part of this. So, and I mean, you were here, so you know what we're talking about. I've been here for almost 6 years, and I live around the corner of the school too. So this community, I feel identified, and I guess now we have a tele advisor with you, doctor. Officially, you are, or medical advisor with the current Texas, license to practice medicine. And we're very, very honored to have you on this screen today.
Well, Dr. Pintado, I appreciate the kind words. Thank you very much. And it's always good to speak with another physician, especially someone who's dedicating their life to education like that. Yeah, I think that's a good transition as far as what I do. As Dr. Pintado was saying, I am an emergency room physician, and I decided this route pretty early on because it was something that really interested me in medical school. The high acuity, meaning the sickness of the patient, right? So if people aren't aware, if you're in a car accident, if you get shot, if you get stabbed, if you have a heart attack, if you have a stroke, if you break your bone, if you break your neck, if you've got appendicitis, who you're gonna see? You're gonna see me. So the emergency room physician has to be well versed, well taught, and knowledgeable in every other specialty, right? So I am not a brain surgeon, but I know everything about brain surgery in the brain. The brain surgeon knows more than me, 1000%. But other than that brain surgeon, I probably know second most of any other doctor about the brain, right? A cardiologist, if you're having a heart attack and you're having a minor heart attack, guess who's treating you? I am not the cardiologist. You're going to come to the ER. I'm going to see it. I'm going to work you up, find out that you're having a heart attack, and I'm going to give you the medications. The cardiologist will see you tomorrow. So the emergency room physician has a very, very stressful, job, in the sense of our job is to know whether or not you're going to die, right? If you're coming to the hospital and you're having chest pain, you're not worried about a little bump on your, little pimple on your chest. You're like, oh my gosh, it's acne. You're worried you're having a heart attack. You're worried you might die, right? That's why you're coming to the emergency room. And so our training is focused around that. So any organ system that can affect you and possibly kill you, which is everyone, we have to know about, right? And this is same with Dr. Pintado's work. So if a patient comes into Dr. Pintado's office and he thinks that patient is sicker than they think they are, he's going to send them to the emergency room to see me. So his job is the same. Identify who's sick, identify who needs a little bit more than what you can do, and send them to the ER. Then I do the same. I identify if they're sick. If they have a broken bone, I can set it, I can put a cast on. But if their broken bone's sticking out of their skin and is open like this, they're going to need surgery. Guess what? I'm not a surgeon, so I can't fix that. So I call somebody else who can fix that. So this is a chain of kind of custody and kind of continuation when it comes to being a doctor. So when you decide what kind of doctor you want to be, you're like, do I want to be the overall, all around, like knowing a little bit of every other specialty? Then you're going to be, as Dr. Pintado is, a family practice doctor, as I am, an emergency room doctor.
So I have a question. In your times in the high school, there was no pathways. Were there anything related?
The only thing that we had during my time in 97 to 2000 was we had Miss Moon, and we had Serendipity, right? Is it still there?
Yeah.
Yes, we had Serendipity, and I was lucky enough to actually be there for a day once, but that was it, and that was really cool. So Serendipity was around when we were when I was in high school.
Well, now I'm telling you, Doc, you will be proud that what happened the last years, that we as a district and high schools, we're building different pathways, different academies. I just showing you a little bit of one of the classrooms that we have. I call this the health science medical lab. And we have basically a 3-year pathway in this high school where we teach the medical terminology the first year with a lot of heavy component of first aid and CPR and community emergency response team. And in the second year, we have the course that introduced to the healthcare careers. And the 3rd year, Doc, we have emergency medicine. The students are trained to become emergency medical responders. It's the only minor that can actually get a national certification. You know that? And we're proud to have it. I was able to buy an ambulance that we have in the school. So we go all the way. We have a group called HOSA, which is Health Occupation Students in America, or Future Health Professionals, that also we are, they not for physicians, dentists, physicians, you name them. So we are very proud to have you to tell you that we are building this community, and your presence today should, encourage us more to keep trying, keep putting the seed in these students so they can become somebody like you, Doc.
Well, and Dr. Pintado, I know but that warms my heart. I mean, it makes me feel like wow, you guys, the commitment, if students are listening, the commitment that is being displayed here for you guys is amazing. I can only imagine if we had something like this to guide us along, what a lot of us would have become, because it is as when you get older, you realize a lot of this is opportunity. It's nothing else. It's not you. It's not your education. It's not your brain. It's not you. It's the opportunities you are given, right? And there's I love hip hop. I mean, that's my music, right? So there's a good quote: opportunities are never given; they're taken like interceptions. All right. So this is an opportunity that you take. Okay. This is something that Dr. Pintado's talking about. I mean, that commitment, getting an ambulance, seeing that stuff, this is where you start realizing, yeah, I want to do something with my life. I want to progress in life. I don't want to, hey, I can work, and no offense to McDonald's, I can work at McDonald's for several years and make a little extra money on the side, but I'm not going to become that. That's not going to be my life. I want to do something else. So that's this time, guys. This time is also time to, hey, like I want to set a career path, but it's not the end of the world. It's not, oh my gosh, if I don't pass A, I can't move forward. As we were saying earlier, if I get a low score on my SAT or lower than I wanted, that, oh my gosh, my world is over. It is not. Remember that. It is not. You're talking to a guy who never took his PSAT. All right. And I'm not saying don't do that. Of course, take your exams, but there are ample opportunities and pathways in this country to become a physician. Even if you graduated college already and you, like we said, and were an engineer, you were a nurse, a math teacher, whatever you were before, you still have an opportunity to become something else later. Hey, if I don't want to be a physician anymore, I can go back and get a master's in something else, or go back to school and do something else too. It doesn't have to be just this way, right? So that's the beauty of education here, is you can always choose to start it at any point you are ready. The benefit of starting it early is the advantage of that is just knowing what you want to do, getting things done quicker, earlier, at a more, appropriate time. But that's it. There's not much else. So if you're already in these pathway classes and in these courses, you already have that idea. You already know what you want to do. You already have an inkling of, I want to save a life one day. I want to make this world better for my fellow man. And that's what really, that's what a physician is meant to do in any single way, whether it's cancer treatment, whether it's, making sure that your diabetic medications are correct, whether it's, saving that life, in that car accident, whatever a physician means to you is what a physician is. I mean, really, because at the very baseline, all physicians want to make life better for other people, right? And that's the baseline of coming in. So if that's your baseline thought, you're already a physician. You just have to prove it to everybody else, right? So that's again why this is still up here, is you will have a story, and then you will have a story, and each roadblock that you hit is a roadblock. It's not a dead end. It's not a closed door. It's a roadblock. Roadblocks we can go around, we can jump over, shoot, we can plow right through them if we want to. But those are what they are. They're not dead ends. They're not, black holes. They're not places where you're like, oh, I'm in despair and I can never do this because I felt one thing. No, remember, there are many, many, many options. So thankfully, with where I work in the ER, we have the last 2 years, we actually became affiliated with the University of Houston School of Medicine. So we now have a residency program. So I do teach, I call them baby doctors, the residents, the ER. So we're 2 years in now. I'm an associate professor for emergency medicine at the University of Houston School of Medicine. And so watching and now kind of taking a back seat and letting all the young doctors really do the life-saving, and I just make sure they do it correctly. It's interesting to watch, the bright, the light, their fascination with medicine, that now they went from medical student and, in June, now they're doctors. Like, oh my gosh, and, they're saving lives. And it's COVID, by the way, right? So two years now, we've had doctors graduating in this COVID crisis, or medical students graduating in the COVID crisis, who question, oh my God, is this right for me? I'm now in the middle of all of this. And they took it like a champ. They went right in, jumped right in, and started saving lives of patients with COVID, because that's pretty much all we're still seeing, right? And they never once thought, oh, I'm scared, I am not coming to work. Unfortunately, we have lost many people in our hospital saving lives of COVID patients. We lost a resident, not an ER resident, but an OB resident who wanted to be in OB-GYN. She was an intern, and she caught COVID likely in the emergency room while she was rotating, and she died. We've had several of our paramedics die. We've had several of our nurses and doctors upstairs, thankfully not in the ER, die. So it's not a fun game we're playing, but it is something that, we've taken this oath that we're going to continue doing this, even with the stupidity of some of the laws that are being created in different states. So it only reinforces, your love for medicine and wanting to help people. Because I will tell you, although I'm upset and angry, I planned a family. I have a 3-year-old and a 2-year-old. Some of my brothers and sisters have never met my 2-year-old daughter because COVID hit. And then, so when the vaccines came out, we planned a vacation for this past July, starting in January. I planned this vacation for 6 months. Then Delta hit, so we had to cancel it. And so we're still here and we haven't left. And so my brothers and sisters have not met my daughter. And it's quite upsetting, and it makes me angry at people. But when they show up to the hospital in the ER and they're dying, none of that registers to me. I'm not angry with them. I'm not angry at that person. All of that goes away. Because it's a person, right? That's someone's father, someone's son, someone's brother, that kind of stuff. So the anger goes away, and that's what you don't want to be too jaded in that sense where, you're just so angry with people that you can't do your job right. So it's a very interesting kind of job to have to remove, a lot of those thoughts. I work in a very interesting community. We do have a lot of white supremacy, a lot of swastikas, a lot of, we have a couple of, the Aryan Brotherhood's really big, just, about 40, 50 miles north of us. So I've saved lives of people, I don't want to get too graphic, but, call me N-word, like that stuff and all this other stuff. And it's like, it really, that, as Dr. Pintado was saying, your skin does get thick. Because my one retort to any of that is like, I always say, I've been called worse. It's just my little joke. And I keep going because I don't care. I'm not here to judge who you are. I took an oath to save anybody's life. And that's what I do. And so I don't judge, I don't sparse between and just yesterday, the swastika chest tattoo. I don't care if that's what it is versus, someone, a Muslim woman who comes in a hijab. In all honesty, I don't care. Like if you're sick, you're sick and you need help, and that's it. And so that's the way a physician should be, and that's how we try to teach it to our young doctors as well. Is that although this makes you angry, it makes you upset with people because we're being accused of making money off of COVID, faking diagnoses, all this other stuff. And as you guys, as educators, are being assaulted as well, you're seeing this doesn't make any sense. But we have to keep moving, and we have to keep showing, that we're doing the right thing, because we're all in this together. This is not going to get better without what you guys are doing, wearing masks, avoid, it's crazy. Can I share something? It's very interesting. I had my antibodies checked 1 week ago. I will tell you, so I've been doing this COVID thing, right? A year and a half now. I haven't missed a single day of work in 10 years. So, but I have not missed a single day of work since COVID. I've not been sick, but so I've never had the need to get tested. We've been quarantined a lot. I spent 8 weeks quarantined alone in a room in a shack, away from my family when COVID first started. So eventually we just kind of moved back in and said, if I'm going to get it, we're going to have to accept that the family gets it, because it was not psychologically good for me or the family that I was away for so long. So I got my antibodies checked, and guess what? They're able to tell the difference between, natural immunity, vaccine immunity. I apparently have never been sick with COVID. I have never caught COVID. I have antibodies to the vaccine, but that shows you if you do the right thing. And I'm doing CPR on patients who show up dying of COVID. I am the one putting them on the ventilator, right? Like, that's what I do. I look down their throat as their COVID's coming up. And I've never once caught it because I wear a mask and proper equipment. So it only makes sense, even in the most scary of first line workers, which is my job, and I would say medics and ICU docs as well. You can protect yourself if you follow the science and wear the proper protection. I mean, it's just provable over and over and over again. And so that's just very interesting. But also, it goes to show that if you're following the right PPE and wearing the right and doing the social distancing and all this other stuff you're doing, you're gonna do okay. And so hopefully that's the case with all of you guys as well. Now, I know there's a lot of times people are very interested to see what actually we do. So if you're okay with it, I can show you some images and some pictures. I know people want to see some gory stuff, and we can go from there. Is that okay?
Yeah, I think it's great. And then I have a couple questions that were privately sent, so I'll ask you those. And yeah, we have a little bit of time, so you're good.
Okay, thank you. I'll try to burn through these. These are graphic. Obviously, I'm an emergency room doctor. I don't see bunnies and and things like that. I do see snakes because we're actually a snake bite center as well. So I see a lot of snake bites. We have 4 venomous snakes here in Houston, Texas, or in Texas in general. So we do see a lot of snakes. Overhead in my backyard about a month ago. I was able to trap him and take him to a different location. I love snakes. I love reptiles, so I wasn't willing to kill it. But it wasn't our backyard, so I had to get him out. So we do a lot of blood and guts, right? And that's pretty a lot of what the emergency room is. And so, be careful. Always wear a helmet, right? So this is a gentleman who's 28 years old who was riding a forklift, and the forklift got stuck in something and flipped over, and it scalped him completely. And it was pretty nice and clean and even. And the arrow is pointing to another laceration deep right on his skull that I had to fix prior. And this was one of those that I spent a lot of time on him because he was young, and I wanted his face, the cut went all the way down his face. I wanted his face to look good. Obviously, like, he's young, you don't want somebody to have a very bad scar. So you try to do your best. And we did. And because we spent more time on him, he looked like it never happened. So this was right after, and he came back and we took the staples and sutures out. He ended up getting like 70 staples, like 40 stitches. It was one of those. I was very proud to work a lot longer on this gentleman than in the ER, you're pressed for time. So you want to do everything as fast as you can, but there are certain times where you're like, no, I need to do the right thing, which is take more time. And even though I'll get a nasty gram later about, oh my God, you spent so much time, it's okay, because it's someone else's livelihood, their face, so you want to do as much as you can.
So I'm afraid to ask, but we don't see the image on the screen yet.
Oh no, did I not share it?
We see your screen. I just see your story. It says my story, the split screen. You're still sharing your PowerPoint.
Oh my gosh. Now?
But you're very descriptive.
So stop sharing your screen. So I see heal. Oh yeah. Okay. Yeah. Now we see it.
Oh, I stopped. Okay.
Yeah, go back.
We're good?
Yes. Now we see him. Yeah. Got it.
Okay. Let's get, these are all extras, and oops, sorry.
That's another thing you can mention at the end there is the Suture Buddy company business that you.
Oh yeah, that's if we get to it for sure. Now you seen them?
Oh yeah.
Okay, so the guy was not wearing a helmet. We're riding a forklift, and forklift like got stuck in something, like flipped over, and so this is what we're left with. So he had a pretty nice scalp, like he got scalped, kind of thing. It was very clean. And again, there you go. So here are a bunch of staples. If we can.
That's very nice work.
Doc, what is the size staples over regular sutures?
So that's a great question. When it comes to any cut or laceration on the scalp where there's hair, it's almost always staple. There's no point to suture because staples are so much faster. Anything on the face usually will be sutures or stitches because the staples will leave a little bit more of a scar. So in places that are hidden and you want to do a quick repair, a staple closure is much quicker and faster to do than the stitches. So this gentleman right here, I stapled his entire scalp. Unfortunately, I didn't take good enough pictures, but on his actual temple area, near his eyebrow and everything else, that was all stitched together. So staples are very good for anything, covered by hair, and everything else, usually we stitch.
So we had one question
Yes.
that popped up, and because we have about 10 minutes max, what inspires you to do the work that you do?
Knowing that I was told that I couldn't. And if I listened to them, there would probably be a lot of people who would be dead now.
How many lives do you think you've saved in your career so far?
I get that question a lot. I only remember the ones that I lost. I don't know how many I've saved.
Well,
But I do, I remember a lot. I remember a lot of the ones I've lost. Unfortunately, I do pediatrics and adults. So I do emergency medicine for everybody. If you're 0 years old or you're 100 years old, I can save your life if I can. Unfortunately, there are times where you can't. And it's not you, and you have to know that. There are circumstances out of your control, and they're very sad stories. And in the pediatric world, there are a lot of them. So I do remember a lot of the ones in pediatrics that I saved. I do remember those faces, but unfortunately, you remember a lot more of the ones you lost. That is a problem with me. I think I eat those and I take them home and I absorb them. Probably not the best way to deal with it, but I think it makes me a better physician because I absorb them and I try to find some kind of golden nugget that I can use to save someone else's life in the future. That's what gets me going, and that's what keeps me going. And now that I'm a professor and a teacher, what keeps me going is teaching and giving my knowledge to younger doctors and instilling it into them and watching them save other people's lives. Like, that's cool. So that's what keeps me going.
I love that. Another question that a student had sent me earlier was when, our students, especially the students who are in like the biotech and the medical pathways and the health career pathways, they know they want to be in the health field, but they aren't sure if they want to be, physician or nurse or phlebotomist. I mean, all the different, opportunities that are in the health field. What is a piece of advice that you would give, young people in high school that are interested in the field, but aren't sure exactly which way they want to go? Is there a piece of advice you'd give them to help them maybe narrow it down a little bit?
Yes, there is. So the first question you're going to ask yourself is, well, what do I really want to do? Do I want to work with my hands? Do I see myself doing an operation and cutting them open? Do I see myself in the operating room helping with it? So it depends on what it is specifically that you see yourself doing, but the path is there's a continuum. Yes, you can become a doctor and do all that, but guess what else? A physician assistant, a PA, the most popular career path for the last several years is a PA, because you get done in 2 years, not 4 years of medical school. You don't really have a residency, and you're working with your hands. You can be a PA and work with brain surgeons. You can be a PA and work with sports medicine doctors. Okay, well, if you're like, I like the bedside, I love being involved with the patient, everything about the patient, maybe I want to be a nurse. Then you could be a nurse, and guess what? And if you're, hey, I'm tired of nursing after 10 years, you can go on to become a nurse practitioner and actually do more things like a physician as well. Where you're like, oh no, I love the CPR, lights and sirens, ambulance flying, road going 90 miles an hour, nothing but action. Then I want to be a paramedic. I'm not telling you to become a doctor. I'm telling you, if you feel you want to help another person in life and save another life, there are a lot of paths, like you're saying, Aaron, to doing that. A physician is one of them. A PA, an NP, a medic, a flight. My friend, she was a respiratory therapist. And respiratory therapists, we know now a lot because of COVID, right? And they're doing a lot. So she, after 1 year of COVID, got tired of doing it. So guess what she does? She does air ambulance now. She's on a chopper and saving lives.
That's
Picking up people that are sick and taking them immediately and doing everything in the air. Like, that is crazy and amazing. So that's what she's doing. She went from RT to that. So the medical world, you can get into one field and do something else afterwards as well. So there's a lot of avenues. Knowing that you want to do it is one thing. And then there's obviously time commitments, which if you're like, hey, I'm willing to put it all in, the longest commitment is becoming a doctor. But there are so many others that are not as time committed that allow you to do a lot of the same things. And the main thing is allow you to help and save lives. And so any of those along those paths, if you're like, hey, I love blood and I'm a vampire, I just want to stick people with needles all day, phlebotomist, and trust me, I'm scared of needles, believe it or not. So a good phlebotomist, so easy. Like, you don't feel the pain. Like a bad phlebotomist, they're digging in there, right? So there's good phlebotomists, there's bad phlebotomists. So there are so many paths to getting into the medical field, and so many different levels that it's so open. And I will tell you one more thing. With the climate crisis and everything else, being in the medical field is a good play for the future, as we've seen here. You have friends who are doctors and nurses and this and that, the other, and medical advice and those kind of things. It really does help as well, because a lot of our future stuff is going to be, like when things flood and power goes out and people are on dialysis and they can't show up, where they're going to show up to? The hospital, right? So I've worked Hurricane Sandy, I've worked Hurricane Harvey, I've worked Hurricane Irene, and I've worked the COVID crisis, all of them at their points. And so I've seen where it's not the medical part. They didn't need a doctor. They needed electricity. And the only place in the entire city with electricity is the hospital. They need electricity to keep living. So there are so many different aspects of medicine. Respiratory therapist is another one, right? X-ray tech. If you love the X-rays and the physics behind that, there are just so many ample avenues in medicine that every single person, if interested, will find something they like about it.
Hey, Doc, very quick. I want to show you something. You see that?
I love it.
Well, it's yours. So I have another for you here in a hoodie that I want to send to you, but I don't know. You need to talk to Erin about an address, like a hospital or whatever. You need to have this. This is from our heart to you, please. Or you want to come and pick it up? Well, even better, huh? But
yes, I will talk to Erin. That is awesome. Thank you so much.
We'll send you a packet so you can wear it with pride, okay?
I definitely will, because in the shadows of the mountain, Diablo reigns supreme.
Yeah. That's one thing. Second thing before you go, because you're gonna go very quick. Because it's important to address what do you think about the complementary medicine or alternative medicine, holistic medicine? What is your opinion about that?
I think that's also medicine, right? I mean, if people don't realize that complementary medicine, alternative medicine is how medicine started, right? A lot of our medicines come from the ground, come from plants, the aspirin, everything, like the world is has given us all these gifts to help us evolve, right? Mother Nature has given us all these gifts to find this, it's like a scavenger hunt. You know, what can help us? This aloe, where does aloe come from? It comes from a plant. All of these medicines that we have. Now we have these, there are times, okay, some things when you're drinking a Red Bull or a Rockstar, all those extra vitamins and things in there, if your body doesn't need them, it's not going to absorb them. So you're going to pee it out. There's a joke that America has the most expensive pee in the world because we drink all these vitamins and they just pee out of our system because we don't need them. That's one thing. So there is the problem with big business getting involved with alternative medicine, but I believe in it. Absolutely. There's a lot that we still don't know about Mother Nature and what it has to offer us in so many different ways. You know, we use bacteria to put in other bacteria and make medications for us. I mean, this is crazy stuff, right? The kind of technology we're living in, but it's technology with Mother Nature. And there's still, as a med student, I did do a month with an alternative practice doctor in Sacramento. And so a lot of CoQ10, a lot of niacin, a lot of other things that really do help the body. So yes, absolutely. Alternative medicine, it's very beneficial to man.
So because of our time constraints, and I know you probably had a lot more to show us, but we had some great questions. And so I just want to ask one last question, if you don't mind, but what is like the coolest or the craziest case or patient you've ever had, or what's like a story that you'll always remember, and it's something that you tell your med students? And
okay, I can tell you one that I can get through without crying. How's that? All right. This was actually one of my good saves. So there's two twin baby girls that were born at 28 weeks, so very young, right? And they spent 4 weeks in the NICU, and then they were discharged. So they're 32-week-old, still should be in mommy's belly, right? So these kids ended up getting real sick with RSV. This is before COVID, just a few months before COVID. And they had to come in the hospital. 2 twins. One was about to die, was not breathing very well, so wasn't ready to leave the hospital. And the other one was doing, okay, she was gonna survive, but like looked pretty bad. So I had to put this 32-week on a ventilator. So again, we're talking a baby that big, right? She's not even yet ready to be born. You still got a good 7 weeks to kind of cook in the oven. And so I had to intubate her, and the mom's running around, obviously hysterical, screaming, crying. The nurses are crying. And the airway box that I opened did not have the proper equipment in it to put her on the ventilator. It only had adult equipment in it. Someone mistakenly put the adult equipment to the pediatric box, and we had no other boxes. And this girl was literally if I walked out of the room and looked for something, she would have died. It was, minutes before she was going to die. And so I looked at my nurse, and I grabbed the smallest adult little thing I can use. And again, this is a very crazy stuff. And she was crying, pouring down. She looked at me, she knew what was going on, and she knew this was the only chance. And I go in there with this big old blade to open her mouth and try to put this tube into her throat, into her lungs, so she can breathe, so we can breathe for her. And I looked, and Jennifer, my nurse, was pouring down tears. Mom is jumping up and down behind me, and I just took a deep breath. I said, "One chance, Jamal." And I went in, and immediately I saw her vocal cords, which is what you want to see, flapping away. And I said, "Give me the tube." Tube went right in beautifully, bagged her, got her oxygen back up. We choppered her out, and I still have that blade in my glove box as my reward.
See, there's a life you saved, and you should remember that story for always.
I do.
That's
it's a good
awesome.
story. It's a good story. It's one of those that the other girl, we had her on a mask to breathe, but she got better right away with the mask. But yeah, so that was a pretty good save. I would say. And so they're probably doing much better now.
Awesome. Awesome. Well, if you wanted to show us any visuals, we have about 2 minutes and then we need to let the kids get back to class.
Dog bite. Dog bite. Don't ever get involved with two dogs fighting. And then, as we said, unfortunately, we do see a lot of children. So this was a great gash on a kid that I had to do a double layer closure. Stitching, as we were talking about the suture buddy, I have become kind of a closure expert. Here's a chainsaw. Chainsaw always wins. And then chainsaw again, always wins. It just filleted his hand. So these are times where I'm not fixing this guy. This guy went to a hand surgeon. We admitted him, he goes to the hand surgeon. So it's knowing what you can fix and knowing what you can't. Don't get drunk and get too close to your puppy. They'll bite your eyelid off. That's what happened to him. His brand new puppy just bit his eyelid off. So that was pretty cool because he was crying bloody tears. So he got his tear duct. And so all his tears were bloody tears. It was a pretty cool thing to see. And a lot of amputations. So we see a lot of finger amputations, a lot of, that kind of stuff. Usually you don't get your tip back. We just put a nub on and you lose that tip a lot of times. And then a lot of, open fractures, falling and things like that. So a lot of blood and guts. If you like blood and guts and you like the high acuity stuff, the emergency room is a way for you, or being a paramedic or an emergency room nurse or emergency room PA or an emergency room NP.
You just lost them. I'm not kidding. No, this is good stuff. This is the real. You're the real. Grey's Anatomy, doc. You're the real one.
Well, our hospital sees a lot of sick people, so we get a lot of good experience there, and that's why we're happy to have the residency program too.
You are in Houston, Texas, one of the world capitals of health and science, and and medical advances. Is well known.
We have the largest medical center in the world. Houston, Texas has the largest medical center in the world, and we have the #1 cancer center in the world.
You're close. You're Baylor. Baylor is nearby, huh?
Baylor's nearby, MD Anderson, which is the top cancer institute. And then there's a UT Women's, which is top 5 for having your baby birth. A lot of celebrities from LA and stuff fly in and have their babies born in Women's Health Center. And so we have a great medical center in Houston.
Guess what? These guys, they just took a training with Johns Hopkins University. They took a COVID-19 for health professionals training with that university, and also with Stanford. We work with the Stanford too, taking some online training. So we do what we can, docs, and we need you on board.
I would love. I think Aaron and you have sold me, so I'm very on board to help out any way I can and do some future things with you guys in your classes. I think that would be great.
We will not let you go. We will not let you go.
Jamal, thank you so much for speaking to our students today. If once everybody hangs up, if you can just hang on with me for 1 second, I am gonna stop recording now.